welcome to the Isle of Wight. Is this your first visit here?
It's my first visit as a minister, yes.
And what was your impression of St Mary's?
Well, it's a very inspiring go-ahead place, and I particularly wanted to come because I knew that a great deal of good work is going on the Isle of Wight, which I think many other parts of the NHS and the rest of the country can learn from. There is a great deal of innovative thinking going on here as to how to build services around the needs of patients and how to coordinate things much better. And I've seen a whole range of examples this morning and this afternoon that demonstrate that to the full.
The hospital here and the health service here is very key to people on the Isle of Wight. They like it on the Isle of Wight as well. Obviously, in times of budget cuts, services are at threat of moving to the mainland. What kind of assurances can you give people on the Isle of Wight that they can get as much service here as possible?
I can tell you that everyone I've spoken to today is aware of that challenge. And that's why I think at a time like this, it's right and important for everybody in the care pathway to try to think out of the box, if I can put it that way, as to how can services be delivered more efficiently with better results for patients. And we're seeing that happen here. I am absolutely convinced that the work that is in progress on the Isle of Wight will progress to a stage where services really are being delivered around the patient in an effective and efficient way. It's already happening, but there's more work to do, for example, to build in the work of social services, integrate those with healthcare, and thereby to ensure that services remain local.
You've seen the NHS 111 phone centre today here at St Mary's. That's being pioneered on the Isle of Wight. Having seen that, do you envisage that's something that will be rolled out across the country and modelled here?
Yes, it's early days on the Isle of Wight, of course, for 111. It's been going for a couple of months, I think. Early signs are good. I spoke to one patient today who just used it. He complained of chest pains last night. The 111 service responded absolutely appropriately. He was admitted to the hospital here, has had first-class care, and he's going home later today. And he had nothing but praise for that service. And what it's designed to do, of course, is to put the patient in touch with the right service immediately at the right time without being any need to be called back or reassessed. You put through to the right service immediately. And if we can do that, that will tremendously free up people's time and make sure that the system works efficiently.
And what do you make of our Beacon Healthcare Centre here? It's effectively a 24-hour service.
Well, again, I haven't seen anything like the Beacon Centre before. You've got on in one place, one location, the gateway to all the relevant services. There's the walk-in centre, there's the emergency provision as well, GP service, and so on. I'm very struck by the co-location of services here and what that does to bring the different professions and disciplines together and breaking down the barriers that exist elsewhere in the health service, perhaps sometimes to the detriment of patients. It's most impressive.
And just finally, if I may, what will be your message then to Andrew Lansley when you get back to London? What are you going to tell him about the Isle of Wight? Well,
I'm going to tell him that the Isle of Wight is a beacon for what the NHS should be doing more widely. I really do believe that. I think that if not now, then certainly in a few months' time, what's happening here can be trumpeted as an example of excellent practice, which other parts of the health service and indeed the care service generally, if one includes social care, can learn from. So I shall be following progress very closely here. I shall encourage Andrew Lansley to do the same. I think he would feel energised as I do if he were visiting St Mary's now, and hopefully he will at some point in the future.